Welcome to the Rhode Island Division of Developmental Disabilities Community Forum. Tuesday, December 10th, 2024. Hosted by Advocates in Action Rhode Island.
Hello everyone and welcome to our Developmental Disabilities Community Forum. Today, December 10th, 2024. And we at Advocates in Action Rhode Island are joined today by the Department of Developmental, DDD. So I'll turn it over to directors. Well, here, before I do that, let's go over a couple of Zoom tips to get us started. First, everyone should stay on mute and unmute only to ask questions. Tip number 2, it is your choice to turn your video on or off. Join as a panelist to turn your video on. It may help Wi-Fi to keep your video off. Tip number 3, an ASL interpreter is present at this event. Tip number 4, not everyone can use the chat, so try not to use the chat. To ask questions, use the Q&A button. Thank you, and now I will turn it over to DD Director Savage.
Actually, I'm Deb Kanai from Advocates in Action. The ASL interpreter is on their way, so if you need an interpreter, when they're here, we're going to assign them, and you're going to see a button that looks like that globe right there in the third tip that Andrew shared. You just click that and select Turn On Interpretation, and they will show up in another box will pop up on your screen with the interpreter. And the other thing is the thing about the Q&A button is that because we promoted you to a panelist, you're going to see the questions. Usually that's just for the panelists, but everybody who we can see, if you're a panelist, you're going to be able to see those. And we ask you, please do not answer them. We save those for the presenters and for the state to answer. And we like to have those answered out loud so that everybody can hear the answer, so we can share it with everybody, because it's a community forum. Does that make sense? All right.
Hey, hi everybody. I'm Kevin Savage. I'm the Director of the Division of Developmental Disabilities. Thanks for having me on the call this month or this quarter. It's great to be here. So what we're going to learn today is we're going to get an update from Advocates in Action on their leadership series. Sherlock's going to provide an update as well on the statewide workforce initiative. Rypen's going to give a program update. We're going to get some information on conflict-free case management. And if any of you have started working with a conflict-free case manager, I'm sure you have some questions. So I hope that will be helpful. We'll give a division update on what's going on in the Division of Developmental Disabilities, and then what's next for the division. So those are the things we're going to talk about today. And we want to get through those as quickly as we can, because really what we want to do is hear from you and know what your questions are and hear what you want to talk about as well. So we'll try to leave a lot of time for that at the end. So next. So I'm going to turn it over. Who's going to be speaking from Advocates in Action?
Kelly Donovan.
Yeah, Advocates in Action and the work they do. About Advocates in Action and the leadership series, here's Kelly Donovan.
Thank you, Andrew.
And Kelly will take it from here with reading the slides too, right? Because Kelly got some notes. Is that correct, Michelle? So Andrew, Kelly's going to read those slides.
No, Michelle said I was going to do that.
Oh, you're talking about two different slides. Yeah, this one is Andrew, but the next one, Kelly's taking it from.
Right, the presentation. From here, this is Kelly.
Perfect.
Okay. My name is Kelly Donovan, and I'm here to read about Advocates in Action RI's 2025 Leadership Series. The image on the screen are a square that says Leadership Series with many clip art pictures of things that apply to the life of a person with a disability, including a file folder that says My ISP, a person in a box labeled the service system, and a target with a person in the center that says, I am here. At the bottom of the box is a logo that says nothing about us without us, and a circle that says self-advocacy is cool, speak up. Also on the screen is the Advocates in Action logo. What is the Leadership Class Series? The image on the slide is a screenshot of the 2024 Leadership Series on
We
Zoom.
don't have, you gotta wait for it didn't switch. You gotta
Oh.
tell Deb when you want to switch it. There you go.
What is a Leadership Series? The image on the slide is a screenshot of the 2024 Leadership Series on Zoom, making a video about leadership. The Leadership Series is a weekly course from February through June. Class members will learn about leadership skills, personal introduction and communication skills, person-centered thinking and planning, disability rights, how government works and voting, navigating the Rhode Island DD system, technology tips, and much more. Class members will also have a lot of fun making friends, touring the State House, special projects, songwriting, and many more. Switch. Who is eligible to apply for the leadership series? The image of this on a slide is the class of 2024 at graduation. To be eligible to apply for the leadership series, you must be a Rhode Island resident who has an intellectual/developmental disability. You must also be 18 or older age-wise. Those who will be celebrating their 18th birthday in the coming year are also welcome to apply. Family, friends, or support staff who will be supporting a class member are also welcome to apply. Switch. How to apply for the leadership series. The image on the screen is a computer finger pointing to the words apply online. Next to that is a QR code that will lead you to the web page to apply for the leadership series. Visit the special page on our website to find all you need to know about applying for the 2025 Leadership Series. Just go to www.advocatesinAction.org/leaders25_apply.php to learn more and to find the link to the application. You can also open your phone camera and hold it up to the QR code on the screen right now. A link will appear. Click that link to go straight to the 2025 Leadership Series info page. Just leaving it up for a few seconds for anyone who wishes to scan. And the 2025 Leadership Series virtual open houses. The image on the screen shows a Zoom meeting on a laptop. On either side of the laptop are dates on calendar pages with times underneath the dates. Advocates in Action will be hosting 2 open houses on Zoom to talk about the leadership series, answer questions, and to show people how to apply. Excuse me. The first open house will be on Wednesday, December 11th from 7 o'clock to 8 o'clock p.m., which is tomorrow night. The second open house will be on Wednesday, January 8th from 1 o'clock to 2 o'clock p.m. To register for the open houses, go to that same 2025 Leadership Series page that we mentioned on the previous slide, www.advocatesinAction.org/leaders25_apply. Or visit our Facebook page for more info. Switch. Stay in the know. Get on our email list. When something is happening or we have news to share, we send out an email to everyone on our email list. You can join the list by going to www.advocatesinAction.org/contact. Fill out your name and email address, and you'll get all the latest news from us. And the image on the slide is of the Advocates in Action logo.
Can I just say that the state is we're going to have all of those slides for people. So all of the information that's here, you don't have to worry about writing the links down and stuff. And they're also set up, like, for example, this one, if you hold your mouse over it, it'll take you to that link that Kelly just talked about. So when you get the PowerPoint, you'll be able to do those things. Are we ready for the stuff? You guys ready, Kim and company?
We are ready.
All right.
All right, Rhode Island Statewide Workforce Initiative Quarterly Update. This will be from Ken Einloff at the Sherlock Center.
Thank you, Andrew. And good afternoon, everyone. My name is Kim Einloff. I'm the coordinator of youth and adult initiatives at the Paul V. Sherlock Center on Disabilities at Rhode Island College. We are here to provide an update on the Rhode Island Statewide Workforce Initiative. Our goal is to make it easier for employers, both agency providers and those who use self-directed services, to find and keep great DSPs who provide quality support. This initiative was created to help improve the support for Rhode Islanders with IDD by addressing DSP shortages and training, DSP training. Today, I'm joined by a few members of this initiative who will tell you about some new information and resources. We'll also share some upcoming opportunities for collaboration, including DSP listening session follow-up, showing the Sherlock Center's new direct support workforce webpage with resources, sharing a new realistic job preview, sharing a new workforce data report, and sharing information about the upcoming annual Workforce Summit. We'll put links and resources in the chat and an email that you can reach any one of us at following this presentation. We'll start with Amanda and Kelsey.
Hi, my name's Amanda. I'm a part of the Policy Guidance and Worker Voice Work Group. And I just have a little update for us. So the Policy Guidance and Worker Voice Work Group hosted 10 in-person DSP listening sessions and 3 virtual sessions. We wanted to hear their experiences as DSPs, including what they love about their job and what's hard about their job. We also wanted to use this as an opportunity to communicate the work groups with DSPs. 60 DSPs attended, both from working in self-direction and for provider agencies. For those who chose to report their demographics, 80% identified as female and over 60% identified as white. Attendees were diverse in age. Due to scheduling, a Spanish session was not able to be held, but hosting a session in Spanish is a recommendation for 2025. 53 participants said they wanted to join a statewide work group. They were all emailed more information, and as of December 4th, 8 responded with greater interest. They will receive a gift card for each work group they participate in. The work group is currently looking at everyone's responses and summarizing them into themes. A report with full results will be shared in 2025. Kelsey, do you have anything to add to that?
Thanks, Amanda. This is Kelsey. I don't. I think that was everything that we wanted to report on today. We were really happy with the success of the listening sessions, and we're really looking forward to getting that report to the larger group. I think our goal is to have it by the summit, which I think we'll touch on a little bit later. I also just wanted to give a shout out to Amanda. The majority of Amanda's work in her position is direct care, even though her title isn't DSP. So having Amanda be able to participate in a majority of the listening sessions was great to really have that peer-to-peer kind of conversation. So just wanted to give a little shout out. Thanks, Amanda.
Great. Thank you, Amanda and Kelsey. Next, we're going to turn it over to Tyler Miranda.
Hello, everyone. My name is Tyler Miranda, and I'm a employee here at the Sherlock Center. And I'm here to announce that the realistic job preview has been posted for the community. And you can visit it on the Sherlock Direct Support Workforce webpage at riswi.org. It is available to all the employers in Rhode Island and that employ DSPs. And it is a 19-minute video that is meant to be used during the interview process with a potential DSP and shows the reality of the job, including the good things and the hard things, and will help the applicant make informed decisions on whether the job is the right fit for them. We were happy, 3 organizations really worked hard, including BHDDH, the Sherlock Center, and Direct Support Workforce Solutions at ICI, Institute on Community Integration at the University of Minnesota, to really get this up and running and produced. And there was a lot of feedback provided by various groups, including the attendees of the previous RISWI summit earlier this year, the Sentinels, 6 DSPs who attended listening sessions, RISWI's Selection and Retention Statewide Work Group. And the video is available in both English and Spanish. Kim, anything to add to that? No?
I think you covered it well. Thanks, Tyler.
Awesome. Thank you. So I'm also going to be introducing the Direct Support Workforce webpage. The Direct Support Workforce webpage is located on the Sherlock Center's website. You can reach it by typing in riswi.org. And we launched this a couple weeks ago, and it is dedicated to bringing forward best practices, evidence-based strategies, tools, and resources for those seeking employment or already employed in the direct support workforce, such as direct support professionals, frontline supervisors. It is also able to be used by employers looking to recruit, select, train, and retain the direct support workforce. You have the ability to provide feedback on the direct support workforce webpage, and using this link, you'll be able to fill out a form to provide your feedback, and we welcome all feedback as always. This right here, we have a ability to make announcements, and this one is currently seeking feedback for the draft frontline supervisor competencies that the Rhode Island Statewide Workforce Initiative worked on creating. So there's draft competencies in English and draft competencies in Spanish, and using either of those links will also provide direction on how to provide feedback. So on this webpage, we broke it up into 3 different audiences. We have frontline or direct support professional, we have frontline supervisor, and we have employers. If we click on direct support professionals, it provides various resources, including the core competencies that was adopted earlier this year, as well as it in Spanish. The NADSP Code of Ethics, National Association for Direct Support Professionals, and some information about Standard Occupational Code, as well as what will be held on this webpage will be the Rhode Island Statewide Workforce Initiative data summary reports, which will be released and placed on the webpage with each update. So there are various resources on each of these pages according to who you are as an audience member. If you click on employers, it looks a little different, as we created process containers according to recruit, select, train, retain, and data. And they may look a little bare right now. We are building resources as more resources come out. And as I was just talking about the realistic job preview, here is where you can find it on the webpage. So each of these has some information according to the topic. So, or the orientation and onboarding checklist that one of the work groups produced is located right here. The core competency guides, and then here you can also find the data. So some of the information that you find on these web pages, some of them they're located multiple times, but that is because they can be used for different audiences. And that's all I have.
Thank you,
Kim,
Tyler.
thank you.
Very nice.
Thank you. And next we'll hear from Julie Bershadsky. She's going to talk a little bit about the SupportWise Workforce Report.
Hi, everyone. Yes, speaking of the SupportWise Workforce Report that Tyler was just showing on the website, my name is Julie Bershadsky. I'm from the Institute of Community Integration at University of Minnesota. We are the team that in part has been working with Rhode Island to collect and analyze your workforce data. So this, we're happy to report that the latest workforce report has been released and has been, I believe is now published on the Sherlock website, but Kim can confirm that when she has a chance. That report covers the period of January to June of this year. That's the provider organizations that submitted their data on workforce stability. 33 out of 34 provider organizations were able to submit their data on time and are included in their report. I will, in the next couple of slides, I will show you some of the highlights from the data because just to say right off the bat, results are overall quite positive, and there's a lot to be celebrated for the state. The data show that there are some really positive, encouraging trends in terms of your direct support professional workforce stability, and that is really the work here should really be celebrated because it's coming through and it's having an impact. Like with the last report, there will be an easy read, plain language sort of version that Sherlock is working on as well. And both the long version and the short version will be translated into Spanish and posted as well. That's the intro, and now to just a couple of fun highlights of the data. Next slide, please. So starting with wages. These are graphs, obviously, but they show sort of what happened to average starting wages and average hourly wages over the last couple of years, starting from the left to the right. So the starting wages went from just under $19 an hour a couple of years ago to now $20.69 average in this last period. And then the average hourly wages that all DSPs get went through, again, just under $19 an hour. So there wasn't that much of a difference, to $21.12 just over this last period. So wages have gone up, both starting and average, which is great to see. Next slide. This slide shows you what has happened to turnover and vacancy rates during the same time period. So over the last couple of years, starting from the left to the right, the turnover ratios have decreased from 20.7% a couple of years ago to now 15.1%, which is significant reduction. And similarly, the vacancy rate has also decreased from 17.1% a couple of years ago to what is now 11.9%. So of course, still work to be done, but there's a really, really, really encouraging trends to see, and it's really, really kudos to all of the work that you all have done to make this happen. One more fun data point. Next slide, please. This is just a simple slide that shows you sort of the percentage of organizations, so the proportion of organizations out of those 33, 34 that said that they had to turn away referrals during that reporting period because they didn't have enough staff. So a couple of years ago, 2 out of 3 organizations, 63%, said that they had to turn away referrals. Now, in this last data period, that is down to 1/3 of organizations, 33%, which is still, still, again, as I say, work still remains to be done, but it's a huge, very significant decrease, and it's something to be celebrated. So with that, I think those are the highlights. There's a lot more data in the report. Lots more fun things to see if you are into data. But I think that is my time for today. So I'll pass it back to Kim. Thank you for listening.
Thank you, Julie. Yes, much to be celebrated, and trends in the positive direction is what my takeaway is. So thanks so much, Julie. 2 more slides. The National Core Indicator Survey is coming up this month. You'll be probably seeing some announcements on social media and in your email and in the DD newsletter. It's coming and we're excited about it. We're recruiting survey interviewers right now. We'll be recruiting shortly. I think it's about to be released. Next month, we'll be getting those interviewers prepared, and participants will receive a letter in the mail announcing that they've been selected and may be asked to participate in the survey. February through May, the surveys will be completed either in person or in Zoom, depending on the person's preference. And in June, we'll be wrapping up and thanking everyone for their hard work. Some of you may be familiar with the National Core Indicator Survey. It's something that we do once a year. And we're really hopeful that we'll be able to complete the minimum of 400 surveys in order to receive a statewide report that we can then respond to the information collected. So we're excited about the rollout of that survey again shortly. The next slide, please. And lastly, I just wanted to, it was referenced a couple of times earlier in Sherlock's presentation. The annual Workforce Summit is coming up. It's on January 29th. Oops, that says 2024, but actually it'll be 2025. Sorry about that. We'll fix that before the slides go out. It's from 10 to 1:30 for the broader community. We'll hold this event the same place we have in the years previous at Alger Hall on Rhode Island College's campus, and the invitations went out last week. If you did not receive an invitation, it's probably because you haven't recently attended the summit or you're not participating in one of the work groups or the coordinating council. If you are interested in attending the summit, and would like to learn more about the Workforce Initiative, please email us. And actually, if we go to the next slide, you'll see our email address. It's riswi@ric.edu, and I'll drop that in the chat when I'm done talking, which is just about now. So thanks so much for giving us your time, and we welcome your questions later in the session.
All right, now we come to updates from RIPEN's self-directed support program, and these will be given by Susan Donovan, the Senior Program Director. Thank you.
Thank you, Andrew. As Andrew said, my name is Sue Donovan. I'm with RIPEN. There are 3 things I'd like to cover today. Are the Self-Directed Support Conference, which we hosted on November 8th. Our peer mentor panel that we hosted last week on December 3rd, and our 2025 lineup of events. Next. So just to give you a glimpse, the total registrations that we ended with was 326 folks. Out of that, as you can see, this slide shows that we had consumers that were English speaking, 53 of them, and another 10 consumers that speak Spanish. The number of parents and caregivers that attended were 106 that identified as speaking English and 19 that spoke Spanish. We had 55 direct support professionals in attendance, and we had 83 professionals that were there either presenting or they were an exhibitor. Next. So the day was broken up and we provided 3 different sessions. So 2 sessions happened in the morning and then 1 in the afternoon. For session 1, we offered topics such as triumphs in the workforce. We had stories about employment success, so consumers were actually on that panel. We had a state panel from BHDDH. They spoke about the history of self-direction, where we're at, where we're going, what's our vision as a state. We also had a session on what's all the buzz about self-direction, and that was a 101, what is self-direction? And it was a mixed panel with a consumer, parent, caregiver, direct support professional, service broker, plan writer. We also had a session on Link with Your Community, which is an online resource guidebook. Next. Session 2 offered employment supports for individuals that self-direct. And then we had another session on how do I find and keep support staff. We also had a session on who's making the decisions, which focused on supported decision-making and other alternatives to guardianship. We also had Self-Direction Connection, which is a project that Ripen's self-directed program team hosts, and they bring consumers together and parents and caregivers together and direct support professionals together to kind of share ideas and to grow their networks. Next slide, thank you. This is on this slide, you see our friends from Advocates in Action. They were kind enough to host our lunch plenary session with our peer mentor panel, and it was very well received. On the right-hand side of this slide, you see a graph, and the graph shows that the majority of people strongly agreed with the information that they received from the panel. It was of high quality. They understood the information and they learned something new. In the afternoon, we had session 3, and we offered 3 different breakouts during that time period. The first being blending self-directed support with traditional services. The second, what are goods and services? And then the third was a session on natural supports, who's in my circle. We also had a number of different exhibitors present for the day. Advocacy organizations included Advocates in Action, the Paul V. Sherlock Center, the Rhode Island Developmental Disabilities Council, and we gave Ripen a table. We figured, why not? Then we also had fiscal intermediaries there. They're the 6 agencies who offer fiscal intermediary services, so you can go to them to help establish and your self-directed services. Our state agencies, our lead agencies were there, Behavioral Health Care, Developmental Disabilities and Hospitals, and our friends from the Office of Rehabilitation Services. We also had support brokers there, Best Life Rhode Island, Lazo Rhode Island, and the Rhode Island Self-Direction Coalition. This is a snapshot. You may recognize some of yourselves in this picture. This was a snapshot of the exhibitor section, which got very high ratings in our survey. So overall, we did receive 94 surveys, evaluations back, which was wonderful. We were able to provide some in-depth data and information to our partners at BHDDH to show, where folks really were able to engage and connect and get information that they needed.
I know you're going through them to get it done. In the recording, we'll read all of that. So people who are watching it that don't read, they'll be able to
Okay,
know what it
thank
says.
you,
Yeah.
thank you. I was thinking of that, and then I'm thinking, wow, I'm really talking pretty fast here. Sorry about that. I won't read all these to you, but some of the conference responses that we collected, we separated them and categorized them into different categories. This slide shows the consumers, they shared comments like, this was an excellent conference. Thank you so much. Hope to see this again next year. I'll recommend this to a friend.
Conference responses from consumers. This was an excellent conference. Spread kindness. Excellent. Hope to see this conference again next year and in years to come. Thank you. The event was very helpful. Thank you so much. I would like more employment panels. I will recommend to my friends. There is nothing I want to change. Everything was great.
Here we have a slide with parents and caregivers, input from them as well. One just reached out to me. I'm going to read this one. One of the parents wrote that there are a lot about self-directed that feels overwhelming, but with help, one can break things down into manageable pieces and get into a manageable place. And we're not alone. Plenty of other folks are going through challenges and struggles, and we can support each other to get through it all. All the workshops were helpful. I just thank you for humoring me. I just thought that was really kind of nice to share.
Conference responses from parents. Great. Hope to go again next year. I was only able to attend the morning but found it very helpful in navigating self-directed supports. Thank you. We enjoyed connecting with all the different agencies. This was extremely valuable to me. It reminded me that there's a lot about self-directed that feels overwhelming, but, with help, one can break things down into manageable pieces and get to a manageable place. And we're not alone. Plenty of other folks are going through challenges and struggles, and we can support each other to get through it all. All the workshops were helpful.
Our direct support professionals, our DSPs, they also weighed in. They thought the conference was very good. They loved the panel at lunchtime, which I must say, I read 94 evaluations, and the majority of them all gave kudos to the lunch panel. So thank you so much, A&A.
Conference responses from DSPs. This conference was excellent. I loved the forum at lunch about the training, what they were educated about, and how to run a business for themselves. Thank you for having an adult changing room. This was my first year being a part of Self-Direct. People don't understand how the individuals change our lives for the better. They show us the world more than we could see without them. Everything was great. Thank you.
And then also professionals, okay? And I know by the end of the day, I noticed a lot of the professionals, they couldn't stop smiling. So I knew things were going well. Our exhibitors basically spoke to folks for close to 6 hours straight. Every time I walked through the front foyer and checking out the exhibitor tables, everybody was engaged in conversations. People had questions. So there was a lot of communication going on. So thank you to all of our professionals that supported this event.
Conference responses from professionals. Wonderful conference. So appreciative of all you've done to connect us all. Great job, loved the networking. It was excellent, especially for the first conference. Extremely well organized. As an exhibitor, the conference was nicely done. Everything was well organized. Thank you. It was great, informational and helpful.
All right, so last week on December 3rd, we had our peer mentor panel, which was kind of ideal since it kind of came on the tail of our conference. And the peer mentor panel, we had A&A supported Advocates in Action, supported our efforts on this, and attended with consumers who have completed the self-directed peer mentor training. And you can check out, Actually, tomorrow morning, you'll receive those who were involved with the conference. There's a follow-up email going out, and that'll be going out tomorrow with links that will provide some of the content that happened at the conference. You'll be able to check out on Ripen's website. So don't worry if you miss the conference. Over the next 2 months, but including as early as tomorrow, you'll be able to link and check out and look at that. Sharon just put a link in the chat for us. You'll be able to see a lot of the content that was shared at the conference. So same thing here with our peer mentor panel. That recording will be going up on the Ripen website, and that should be up by the end of the week. So rounding up, here we are at our 2025 line of events, our lineup. On January 28th, we have the Sherlock Center coming to share work incentives for youth in transition. So for folks, for youth that are still in school, there are work incentives that they can utilize. And we'll have that, that'll be our first webinar of 2025. In February, we'll have our self-direction connection, which again, will be able to provide a networking venue online, a virtual community for consumers, parents, caregivers, DSPs. In March, we're going to be meeting the communications team. So our friends that are doing communications and training at BHDDH will be joining us, and you'll be able to meet the team, see what they've been up to. On April 26th, we're going to have a very special Saturday morning hybrid event. We will have we'll be sharing a self-directed toolkit with folks on the 26th, and you can come to the Ripon office at 300 Jefferson Boulevard, and there'll be hard copies, right, of different templates and tools that folks will find useful in doing self-direction, like job postings, sample job postings, or timesheets, data tracking tools, things that you're able to use to help you implement and start off your self-directed services. We will also offer that in a hybrid fashion, so that if you have transportation issues or you're not able to make it that day for whatever reason, you'll be able to Zoom in to share in the presentation and see the resources. May is our, our acknowledgement to Mental Health Month. So we will be having a panel on behavioral health, mental health services. And then in June, we'll have a couple of in-person events, which are yet to be, scheduled, but we'll get that out as soon as possible. At Ripon, we are upgrading our online and database system. So we're improving our registration process, and we're doing it so that it communicates with our database. So registration for all of these events will be available on the Ripon website after January 2nd. Next slide. That's the team. Just wanted to say thank you. Thank you to everyone. Last slide is contact information for our program, self-directed support at ripon.org. Thank you so much.
I'm sorry, it's kind of like standing up to take a break instead of staring at the slides for that long. If you just want to see each other again for a minute, because that's what you're supposed to do. Everybody awake? Everybody good? All right.
And now for conflict-free case management, CFCM news. Main goal about services timeline.
Hi, this is Brenda Duhamel from BHDDH. I will give the update on conflict-free case management. Good afternoon, everyone. So the main goal, right, of conflict-free case management is really to make sure that individuals get the services that they want and need. Remember that we have sort of two types of providers doing case management. We have conflict-free case managers, and they're either internal from the state, or they're external with a conflict-free case management agency that we're working with. We also have independent facilitators, and those are folks that used to be an independent plan writer that have participated in some training and are now considered independent facilitators. So case managers, they do not provide any other service. That's what makes them conflict-free. This lets them focus on helping you to find the best services and supports for you. So just another little overview of what conflict-free case management is. It's really a service for people that get long-term services and supports through Medicaid. And the goal is to make sure that people get the services that they need. And again, by only providing conflict-free case management, that agency can focus on helping the person find the services and supports that are available to them. These services and supports might be from an agency or any other place within the state. It's a requirement of Medicaid. Right now we have 10, actually 13 case managers that have been hired internally as state staff. And we have 3 conflict-free case management agencies that are currently working. We have CareLink, we have West Bay Community Action Program, and we have Child. We also have East Bay Community Action Program coming on board, and they will begin this month in December. And we have another organization called Healthcare Connect, which we hope will begin providing services at the beginning of the new year. So conflict-free case management providers, they're responsible to assist you with writing your person-centered plan. They help you to take part in resources, services, and supports that are available in your community. They help you to explore new opportunities and activities that you may want to participate in. And they make sure that you are happy, satisfied with the services that you're currently receiving and can work with you to address things that you might not be so happy with. So conflict-free case management has begun, and it started back in September of 2024. Like I said, we have those 3 conflict-free case management agencies that have started to take referrals. About 680 participants or so have started receiving conflict-free case management services. And a new agency is going to start in December, so we'll be making additional referrals. So stay tuned. Usually the way that it'll typically happen is you'll receive a letter or a phone call that will say, it's time to begin case management. I'll be your new case manager. Let's get together and meet and get to know each other. And you can certainly learn more about that if you go to the consent decree quarterly report that's available from July through September of 24. There's lots more information there.
And again, all of the stuff you see mentioned here, we'll be able to click and get it. So don't worry, be there.
What's new with the division? 2 technical bulletins, TVs, changes to supplemental funding request, S109.
And that's going to be me. I'm Kevin Savage again, and I'm going to walk you through some of the changes that likely will impact many of you. So the first one is the technical bulletins. So technical bulletins are documents that we put out to clarify some policy and practice changes at the department that hopefully make it clearer for you to understand decisions that have been made as we've kind of changed processes and how we do things at the department. So the first one is Technical Bulletin 25-1. And let me just ask this, Johanna, when people get the slides, will they be able to double click on the slide? Yes. So when you get the slides, you'll be able to double click on them and actually go to the technical bulletin and be able to look at it in detail. But the main gist of what the technical bulletin does is it shares details on how people with disabilities can get services while they're in the hospital. And it shares how direct support professionals can be paid. So it tells you both of those things. And it outlines the details of that. When you're in the hospital, if you're a person with disabilities and you need your DSP to provide support, it tells you how you can do that. And it tells you what the rules are, basically. That if you're a DSP if you're a person who needs services, the services that you would be able to obtain are only services that you're already receiving. And the DSP can't provide services, for example, that the hospital would be providing. So they wouldn't be helping you with medicine or getting meals or having an interpreter. Those are all services that the hospital provides. But they would be able to provide you with services that they would normally provide you with if you were receiving services in the community. And so this technical bulletin outlines how you can receive those services if you're a consumer in the hospital, and then how your DSP can get paid for them. The next technical bulletin, Technical Bulletin 25-2, is about the whole life shared SLA program. And it shares details about whole life shared SLA. And I know we've done a lot of talking about what that is and what it isn't. It shares how you can get started in the program if you want to become a whole life shared SLA provider, or if you're a person with disabilities and would like to receive whole life shared living support as your living arrangement. It includes rules for participants in whole life shared SLA providers. And there's a whole bunch of rules on how we can do it and what we can't do in the whole life shared SLA program. So one example that's come up a lot is if you're a whole life shared SLA provider, you can't have outside employment. That is your employment, and that's what you're funded to do. If you need another job, then whole life SLA is not for you as a contractor. And if people have questions on that, happy to answer them as we move along. We've made some changes to supplemental funding requests, which we call S109s, and a lot of people are familiar with S109s, but we were asked by the court on a lot of things to make things easier for people, both for providers and for people with disabilities and whoever is supporting them. So one of the things that we tried to make easier and sort of less grueling for people is this whole supplemental request. So if you had an S109 in the last 2 years, the approval will be longer. So instead of just doing it and you have to do it every year, it will stay approved for the rest of your current plan year and then the following year. No new S109s requests will be needed if you fit into that category. Does anyone on the team, on the state team, have anything to add to that? It just thinks needs to be clarified.
I will, Kevin. This is Tracy
Yeah,
Levesque.
thank you.
We are working with many of our providers to help identify who the individuals are that that fit this criteria, that may have had the supplemental funding request for 2 years or longer. That way, it helps eliminate the need for the new request proactively, and it helps reduce that burden as quickly as possible.
Great. And we're going to
Okay.
send out letters, correct? To
We
everyone,
are, yes,
so
yes.
that you will be notified, so you know how it's going to apply to you.
Thank you.
Okay, next slide. And we can just go to the next slide, please. So the communication team put out an annual program report, and I will turn that over to either Anne or Johanna, whoever would like to walk us through the annual program report. Will that be you, Johanna?
Sure.
Yeah.
I could totally do that really quickly. So the comms team, the communications team at the division worked really hard to collect all of the information of all of the different units within the division, different groups that help provide services to the population, the IDD, intellectual developmental disability population. So we worked really hard to collect all of the nerdy stuff that's very important, all the data, the numbers, and we did our very best to make sure that it makes sense. And so the annual report is in an easy read format. It highlights all of the accomplishments that we've done throughout the year outside of the consent decree. So some of it does have content that might be familiar, something that you may already know, new information, and we hope to do this every year. It's out there, it's on the website, it's hopefully going to be easy to find, but if for whatever reason you find it very difficult to locate, we would love to hear why it was hard to find so that we can make it easier going forward. Yeah, so that's just a very top level overview of what it is. It has a lot of information about all the stuff that we have on the screen. You'll have a visual of what it looks like when you pop it open on the website. There's a link that's going to be in the presentation that Deb and Michelle will put up on the Advocates in Action website. And she's highlighting the actual link there for me with the cursor. And so on the screen, you'll see it says annual program report for 2024. And in the image, there's 2 people sitting in front of a really cool desk with our tablecloth, and that's Pierre from our training team, and we have Elvis from our employment unit. So we're very excited to hear what you think of it. And yeah, we would love to hear feedback. If you have any questions, there's our email addresses there. It's bhddh.askdd@bhddh.ri.gov. It's a lot of it's a lot of letters, but you can just click on the link and it'll pop up. Your email address will just be able to type in whatever you want. You hated it, you liked it, want more pictures, less pictures, more information, whatever you think is going to be easier for you to process information. We'll be very happy to take that into account, and we take all of your feedback very, very seriously. So yeah, that's top level what it is. Anyone else want to add to it, or we're good?
So let me just say that Johanna and Amethyst are also working with the rest of the DD team on improving communication at this meeting and other meetings to make it more accessible to who is ever on the call. So I want to thank them for, they designed the PowerPoint and gave us some talking points, and they're great on the communication team. They report to Anne Leclerc, who's really taken on communication as a way of just making our whole style accessible to you. So we're working hard at that, but definitely keep them informed. And Johanna is absolutely being honest when she says she's taking your feedback seriously. And that's why she's helped to redesign with Amethyst our whole presentation here today. And she's working with all of the other teams who are presenting. So thank you for your hard work. I want to thank all the presenters today. You did a great job. I'm excited about the work and the trends that Julie presented, and looking forward to the conference. Ripon, I just want to second that. That was a great conference. It's the first time they've done a conference like that. And I don't think there's been a conference in public done by a local agency other than CPN that's been in public. And so that was just great. And it was really, really positive, excellent day. I think everybody walked away feeling like they were enhanced. So thanks so much for that. I want to open it up for questions, comments, concerns to the whole community, so that we're here to hear from you. So we look forward to that.
Do you want to see the other slides, or is that?
Oh, I thought we were done.
No, I think aren't there 3 more slides?
Yeah, there are a few more slides.
Okay.
So if I may, in a nutshell, it's just we wanted to highlight top level some of the content that's in the annual report. These are the services that we have been talked about a lot within the division, with the community, peer-to-peer supports, family-to-family supports, and remote supports. On the screen, you have images of 2 individuals with arrows on top pointing in different directions. We have 2 hands clasping to indicate family-to-family supports, and we have remote supports with an individual in the middle of the picture with text and a phone, indicating that you can chat with someone virtually or to connect with them on the phone. So all of this is detailed into the annual report as well. It's services that are yet to be coming on down the pipeline in 2025. They're not billable yet, but we hope to do that in the next near future. Some exciting stuff. And then some of the goals that we have for 2025. We like to just sort of introduce some of the things that we hope to accomplish and provide you as a community of individuals that we work essentially for, right? So it's to continue to meet Medicaid and consent decree orders. We take that very seriously at the division, to continue to strengthen quality of support provided to adults with IDD. Part of that is learning how to communicate better in written and verbal communication with all of our participants, and to continue to build and support opportunities for adults with IDD to make informed choices. We want to make sure that everyone has all the empowered opportunities and information in a way that makes them powerful about the choices in their lives. On the screen, you have sorry,
I don't know why it went away. Hold on.
Technology, what are you going to do?
Yeah, I don't know.
Just to make sure, because we have 20 minutes left and we want to hear from the
Yeah.
community and the
Yes.
participants. So if you have any questions, let's dive into that. I do see a question in the chat about CFCM. Did Andrew want to read the question?
Yes, I will do that. Just give me a second. Right, the question was from Ann Peters, I believe, regarding CFCM. Can you explain how a process moves from the independent facilitator working to create CSP? How does that move to ISP involving agency providing services?
So, hi, this is Brenda Duhamel. I guess I would say that the process really shouldn't be all that different if a person is utilizing an independent facilitator or plan writer to create their plan, then they would do it as they always have. working individual to create the plan and put that together on paper and submitting it to the state, making referrals to the particular service providers or individuals that they may like to deliver their services.
Brenda, the question was mine. This is Ann Peters, and I'm wondering if you're working with an agency that now your caseworker there is helping to write your plan. At what point does this independent facilitator become involved in the process or engage the agency caseworker in the process?
So you wouldn't have both an independent facilitator and a conflict-free case manager because they do the same thing. So you would have one or the other.
If I'm hearing this correctly, Ann is stating that you're with an agency, is that correct?
My daughter's with an agency, and it seemed redundant to have a duplication of services with different motives, to have somebody guiding my daughter's case, but having an independent facilitator, yes, come in to help direct the process.
So the agency, so the whole point of moving to conflict-free case management was to relieve agencies of the responsibility of being plan writers, because that was considered by the federal government inherently conflictual. So the conflict-free case manager would come in to, especially to agency cases, and ensure that the plan is being directed according to what the person with disabilities wants. And an agency can't do that. They can, so we added, this is a new service, we added money to it, so they still have a service coordination function because they often know the person with disabilities well and can provide input, but the plan writing itself can't be done by the agency once we're up and running.
And I guess part B of this question is, I'm aware that some workers for agencies are taking the classes or whatever credentialing sessions to be able to be independent plan writers. Does that seem undermining that the concern about being the agencies being remaining uninvolved in the planning, the independent process?
So a person who works for an agency as a DSP, you mean, or as a support coordinator?
I would say as a support coordinator.
And they also want to be an independent facilitator?
They're taking training to be a trainer, an independent facilitator, yes. I was surprised to hear that because it seemed to conflict with the basic plan for conflict-free management. I can't even say it.
Right. I think we would need to look at that individually because you're right in that someone who is an independent facilitator isn't also working for an organization.
Okay.
And providing direct service, because you can't provide direct services and do case management. You can't do both. You have to choose one or the other.
We had someone a while back who wanted to come to the training and showed up to a training and then said she worked for an agency and we told her she couldn't. So I'm hoping that the person actually told everyone that they work for an agency as well, because that is a conflict.
Can I just ask, when people ask a question, you can use the little raise your hand button on the bottom, or you can just raise your hand and we'll see you. Then just say your name if you're answering or if you're talking, so that people, because there's two screens here and all over the place, and if people can't see also, just so they know who it is. At the next, Andrew, there's a couple more in the chat, but you guys can also, if you put it in the chat and you want to ask it out loud, here's your time. So go for it, or have Andrew read.
This is Kim. I have my hand raised because I just thought it might be helpful for the group to know that the Sherlock Center is the entity that's providing the upskilling for independent facilitators and case managers. And in the application process, we would screen for a person's association with a provider agency so that we would identify that conflict right away before they would actually go through the training.
So there's two more questions in the chat, Andrew, just for the sake of time, if you want to read one of them.
Sure, I can do that. This one is from Rhonda DeGilio, and it said, "We received a letter stating our case manager retired. How do we reach out to, who do we reach out to, excuse me, if we need support? We have not been reassigned.
Respond to, actually, you would contact the supervisor. So if you have a social caseworker who has retired, and I can think of a couple we've had that have retired, you would connect with their supervisor. So I'll just say, if you're talking about Lori Champagne as a social caseworker who recently retired, her supervisor is Supalak Muriel, and she can support you and answer your questions, at this time. I'll leave her information in the
Yeah, I'm
chat.
sorry, I didn't understand the name you said.
Yep, I'm gonna write it right now in the chat.
And Brenda, people can also call the main line of the division and tell
Yes.
them, right? So that's 462-3, I don't remember what it is. Anyone? What's your number, you guys? Joe, what's
the main
your
line?
3421.
3421, all right.
Okay.
It's usually the fastest way. Call the main line and say, hey.
Yes. Our
So-
website also now has the list of staff, and all of the caseworkers appear under their supervisor. If they've retired, however, they should be off of the list.
All
So
right.
yes, you're probably best calling and asking
Okay.
who it was.
And one other question that I haven't been able to get to the bottom of. The individual is blind, and I have made numerous requests through numerous avenues to receive his ISP in Braille. And I've hit a roadblock at every avenue for quite some time, and he still doesn't have an ISP in Braille. So I was just wondering what you recommend, because I haven't had any success in that area.
I'll just say, Rhonda, we'll look into why we're not able to get you what you've requested, and we'll get back to you within the next 2 days.
Okay, perfect. How will you get back to me?
I'm sure we have your phone number in the system. Can we just call you? Will that work?
Absolutely.
Okay.
Well, I don't know if you'd have my number, or my name in the system, or my nephew is the individual I'm speaking on behalf of.
Okay.
And-
I can send you both of them. They were in the class last year. I can just send it to you.
Yeah.
Okay, thank you, Deb.
We'll send the number and then we'll call you back.
I do want to say,
Thank
if
you.
people have any issues like this, where you're bringing up something you're asking for, you're not getting it, you can always send it to us at the division. If you're not sure who, you can use the Ask DD email.
Okay.
Email the division at bhddh.askdd@bhddh.ri.gov.
And we will raise it up to where it needs to be, and you'll get a response.
Okay, because I've gone through the case manager, and I was told that the plan writer should do that, and then I got in touch with the plan writer, and she said, no, they don't do that, that I should get in touch with the case manager. So again, I reached out to the case manager and was told she'd escalate it to her supervisor, and then I let quite a long time go by, and then I reached out to the case manager again, and I've just gone round and round for over 6 months, just trying to.
You see, have to make any more phone calls.
Yeah, no.
Sorry,
Okay, thank you. That's
No, if
okay.
people feel
Thank
they
you.
aren't getting an answer, they can use the Ask DD, and it will go through a different path. And
Okay, thank you.
So Claire has a question on, will S109 changes in place for the last 2 years apply to those using self-direction? And will they receive letters? I'm assuming the answer is yes. Is that correct, Tracy?
Yes, Claire, that is correct. It's across the system.
Thank you.
You're
And-
welcome.
And I also had a question about the data that was collected about DSPs in the workforce initiative. Has there been similar data collection for employers, DSPs who work for self-directed employers?
Julie? Or Kim?
This is Kim. Julie had to leave the meeting, so I'm going to respond to your question, Claire, and I'm so excited that you asked that question, because right now the data reflects the provider as the employer and the DSPs that work for them, the frontline supervisors that work for them. We have been talking with the division, fiscal intermediaries, the Self-Direct Coalition, RIPEN, the Sherlock Center's Self-Direct Supports Network, and we are really working on trying to figure out the most efficient way to collect that information. We are very motivated. We and have intended to. We just haven't quite figured out the channel in which to do that, but we will make sure that we keep the community informed about our progress in collecting that data.
Okay, thanks, because I thought I heard that it was just the providers that was data that was shared today, so thank you for the effort. We'll see. Keep
Our
posted.
pleasure.
Okay. Who else would like to provide input?
This is Deb Kenai from Advocates in Action, and I'm going to give another shameless plug that our leadership series is really cool. And Michaeletti, you want to tell them a little snippet about it really fast? Because we really would love to have people apply. What do you think about the leadership series, Michael?
The leadership series was really great.
You think people should apply for it?
Yeah, I think people should apply for it.
It's free. It's sponsored with support from the division, and it meets every Wednesday. It's a lot of work, but we have a lot of fun. Most of it's on Zoom. We have a couple of in-person events, and the deadline to apply is January 17th. So that's really important to know. So,
Yeah, that's really important to all newcomers.
and if you got lost in all those long URLs, those long web addresses, you can just go to advocatesinaction.org, and there's links there to send you to everything else.
Exactly.
I believe Claire has a question.
Yeah,
Claire?
not a question, but I actually, being retired, have all the time in the world, and I read the DG newsletter and I read the annual report. And Johanna and your Amethyst and your team, that annual report is, and I used to ask DD to give my input, but I'll give it here. It was really, really excellent, and having something like that with the visuals that are there and the very plain, understandable language, having something like that every year to document the progress and how things are going will be really great. So thank you so much for that effort. I personally found it illuminating and informative and easy to read, and I was dreading, some sort of bureaucratic annual report, and this was really fun. So
Good. Thank you.
Good job.
For people who can't see the screen, there's a bunch of those little heart emojis popping all over. And Robert Comiskey, I hope I said your name right. I apologize if not, but his hand is also up to ask a question.
Good evening. Can you hear me okay?
Yes.
I am so confused. I'm sorry about that, but I am. Because we recently had a meeting with what I thought was a conflict manager, but I think she said her title has been changed. And I was under the impression when we left the meeting that the agency that services my son will be writing the SIS, or the ISP, I guess it's called, and that her function is not to write the ISP. So if the agency is not writing it, and she's not writing it, I'm confused as to who is writing the ISP.
I will let Brenda handle that.
Hi, so, without specifically knowing the details, what I think is likely happening is right now we're in a sort of a transition period, and we don't expect the new case managers to jump in and help write a plan for someone that they really don't know very well yet at all. And they're very new to this work. So what we have shared is that what we expect providers to do along with the new case managers is to work collaboratively. So that if the provider has written the plan and knows the person well, and this is the first time you're meeting your case manager, we're not going to expect the case manager to jump in and write the plan right away. We want to give them a chance to get to know the individual. And in the meantime, the provider can still write the plan for this time period.
Okay, so that that clears up the my confusion. Yeah, thank you. I appreciate it.
Sure.
Thanks for asking. Anyone else? Happy to hear from you no matter what. You're frustrated and you need to get it out. Go for it.
I have a question.
Okay.
So my nephew is new in the developmental disability system, May of 2024. And so I anticipate that we'll be up for renewal in May of 2025. And I was just wondering, what should we expect the process to look like?
This is Brenda Duhamel. I'll just start by saying once a person is eligible for services, they're eligible for the IDD system, then they're always eligible. So you don't have to redo eligibility every year. When a plan is developed for your nephew or with your nephew, then from whatever date that is that things get started. So say their plan is written and it is to begin, say, in October, and it goes from October to September, that's when the new plan will be due the next October. So they're done annually. And so the case manager would come in and begin to talk about, what kinds of goals and how things are going. And so they would start to plan for that meeting prior to the 1 year mark.
Okay, so his 1 year mark is May 1st of 2025. So
is that the 1 year mark from when services are beginning or the 1 year mark from when he became eligible?
His services began May 1st.
Okay, so right. So then if that's when his plan starts, it would be probably a couple months before May when the case manager is going to start working, with him to create a new plan for the following year. Okay.
So will we expect to be hearing from a case manager or the plan writer?
So if you have a plan writer, if you have a plan writer already, then the plan writer.
Okay, so and so if I don't hear from the plan writer, in what window should I start reaching out?
So usually folks begin to start preparing to do the plan a couple of months beforehand. So if the plan is due in May, then I would suggest in March.
Okay.
Folks would be, reaching out and starting to do this work.
Okay. And, so obviously we've gone through this process once. Should I expect the process to be similar for the upcoming year?
Yes, I think so.
Okay.
What will be different is you'll be reviewing what's already happening and how well that's happening. And are there changes? There may things you want to keep the same, things that he may want to change. And so you're not starting from scratch. Now you're starting from what's already happening.
Okay. And he'll have the opportunity to continue the things he liked, or maybe to add some things that have come up during the year that he has expressed an interest in.
Yes, absolutely.
Okay, so I can start kind of gathering those thoughts in preparation for his.
And him thinking about what he wants to achieve over the next year. What kinds of goals he has and what kinds of experiences and opportunities he may wish to explore.
Perfect. Yeah, I was just kind of thinking in my head, what kind of conversations should we be preparing for to make sure that Dan knows what he wants to do and so forth. So I think I have a better understanding. Thank you for the clarification.
And the time is now 4:31.
Okay, and Robert Comiskey has another question. This is Deb Kanai just saying that. So if you guys have one more minute, I know you were so confused before, Robert, and this is a great place to get another question answered. If anyone needs to leave, you can leave, but I think it's just a good opportunity.
Thank you for the opportunity. And this is Robert Comiskey again. Somewhere along the line, I picked up on like a validation process that is going to be put in place to validate, like when the caseworker or manager starts to write the CIS or the ISP, it'll be validated against a control group from previous ISPs to see if there's variances, to see how it tracks with previous ISPs in terms of budget and the like. Is that ringing a bell with anybody that can add any substance to it?
Sure. Hi, Robert. This is Brenda Duhamel again. So I guess what I would say to that, and I think maybe what you're potentially hearing about, is in our new data system, WellSky, when the plan is entered into the system, the case manager does have to sort of validate the plan. And one of the things that we were very interested in when we built this system is if a case manager writes exactly the same plan as was last year, we would want that flagged for us so we would know that. Because what we really expect to happen is that every year it's a new planning time, and it's an opportunity for people to talk about things that went well, things that maybe didn't, what they want in the future. So it's not expected to be a cut and paste from one year to the next to the next. And so there was something put into our system so that if it looks exactly identical the following year, we would know that.
Okay. Yeah, I'm certainly not questioning it. I was really just trying to get some sense of what the validation process was.
Yeah.
You know.
The validation tool in the system is really there for a quality check to make sure that all the right parts are there, that there's a signature, for example, that there's a date on it, that those sorts of things. And one of those things is that it's not an exact cut and paste from the previous version. Okay. So that's what the validation is for.
Okay. Thank you. Thank you all for staying a few minutes extra. That's above and beyond. Appreciate it, though.
I'm happy to answer the questions.
Have a good evening.
Thanks, you too. Anybody else?
I just wanted to just dive in and say thank you to everybody. This is the comms team's first time kind of facilitating this. If there's any feedback, things that would make it easier, better, more inclusive, more engaging, please email us, smoke signals, whatever you'd like. We'll come to you if you have anything that you want us to do differently. We're hoping to make this more engaging and interactive. If you want to participate or present or ask questions or share some of your experiences with the changes with either the Sherlock Center, Ripon, or any of the things that you've experienced, please let us know. We'd be happy to facilitate you being presenters at this as well. So yeah.
Thank you.
Welcome.
Take Johanna up on that. She will be very helpful to anybody who wants to. If you want to be a presenter and you want her to walk you through it, she'll be happy to do that. So take her up on it. And she's very easy to talk to. So, all right, everybody. Thank you so much. Thanks for being so engaged. We appreciate it.
Thank you.
Oh, you're welcome.
Everybody apply for the leadership class. Bye.
Happy holidays.
Happy holidays.
Merry Christmas.
Happy open
Happy
house.
holidays.
Contact the Division of Developmental Disabilities. Phone 401-462-3421.
Para dejar un mensaje en español, 401-462-3014.
Email bhddh.askdd@bhddh.ri.gov. You can watch this recording again and find out more about the topics that were discussed at www.advocatesinaction.org/DD Community Forums. Produced by Advocates in Action Rhode Island for the Rhode Island Division of Developmental Disabilities. Remember, nothing about us without us.